Yes.
I'm Michael Eisenman, and today I'm going to be talking to you about the current health care bill. My major claim is that the current health care bill is flawed, and I'm going to prove that with 3 points. And my first point is that the health care bill will have severe budget implications. My second point is that the health care bill will result in health care being rationed. And my third point is that the cost of health care will fall disproportionately onto the middle class. Now, to my first point, the health care bill will have severe budget implications. As of October 13th, our national debt has risen to $11,917,161,433.90. Since September 2007, it's risen about $3.9 billion a day. The bill is estimated to cost another $1.5 trillion over 10 years, and it will be funded mostly by new taxes and cuts to Medicare. And that leads to my second point, which is the health care bill will result in health care being rationed. Now, by rationed, I mean it'll be harder for people to get treatment quickly because there will be so many more patients with not any more and possibly less physicians. So Medicare and Medicaid funding will be reduced by $500 billion, and the cutoff will be raised to 133% of the poverty line, which means, well, basically, if you don't make 133% less money than what is considered to be in poverty, then you don't get Medicare and Medicaid. And every 5 years, there will be a meeting that isn't required but is strongly recommended that you have with one of your physicians. And there they talk mostly about preventative care, but including preventative care, they talk about ways that you can euthanize yourself if you get too sick. So instead of trying to get treatment, you just kill yourself and end your life early. I don't think anybody should really have to talk about that. But, you know. And thirdly, 8.5 million American citizens still won't have coverage even with this bill. If we're going to spend all this time and all this money trying to make a bill that's supposedly universal health care, why are 8.5 million people still not covered? And my third point is that the cost of the health care bill will fall disproportionately onto the middle class. Michael D. Tanner, who is a senior fellow at the Cato Institute and was a co-author of Healthy Competition, What's Holding Back Healthcare and How to Free It, basically says that the Baucus plan imposes a 35% excise tax on plans that offer benefits in excess of $8,000. Insurers would most certainly pass this on to consumers in the form of higher premiums. And roughly half of Americans, mostly middle class, will be affected. There are also fees on prescription drug companies, medical device manufacturers, and clinical laboratories. That's just a way of hiding taxes that will overall increase the cost of healthcare. He also states that while the employer mandate is much watered down, it's still there, and the Baucus plan has no specific requirement for employers to provide insurance, but if any employer doesn't, they have to pay the same amount that the government would give as a subsidy so that people can get their own insurance, which would be up to about $400 per worker. And since it will ultimately be the worker that would pay for their own subsidy through reduced compensation or reduced employment, the government will be giving a subsidy with one hand and taking it back with the other. And finally, Jacob S. Hacker, who is a professor of political science at Yale and an author of The Great Risk Shift, The New Economic Insecurity, and the Decline of the American Dream, has stated that personal and shared responsibility means employers and individuals should be expected to contribute to the cost of the coverage. Yet this responsibility creates a countervailing obligation on the part of the government to ensure that workers and firms have a choice of good and affordable coverage that offer security and stability. The box bill fails to meet this obligation. Not only are federal subsidies for low income and especially middle income Americans inadequate, but the standards for coverage are extremely weak. And larger employers could offer coverage with extremely high deductibles, but with limited benefits, and without any penalty by the government. So their workers would be required to take this unless it costs a whole lot of money. So basically that is why the current health care bill is flawed.
All right, the proposition's identified. It's a little broad, but you have good supporting points that are clearly identifiable. You signpost them as you go through the speech, so it's easy to follow. I think the evidence on the first point is basically background information. You don't give any source citation on it. On the second point, it's mostly explanation, and I think you need some data or expert authority to suggest your conclusions are true. The strongest amount of evidence that you had was on the third point. You consistently cited authorities and explained their analysis and provided qualifications for those people. So I think that's the strongest part of the argument. I thought it was delivered very nicely and it used its time effectively. Thank you.